We are going to hear from Pooyan Moradi talking about post-brain injury epilepsy.
Actually, very nice to talk to people in the brain injury Nova Scotia. Closer? Okay, sure. Is it okay now? I'll try to talk louder too. Okay, awesome. Sounds good. As I said, it's very nice hearing these fantastic programs across Canada, especially in Nova Scotia. But today I'm actually going to just change the gears and take a look at the injuries from the lens of research. I think I'm one of the speakers who's going to show some of the research happening here at Nova Scotia, Halifax. The title of my talk, of course, is looking at the short and long-term complications of traumatic brain injuries. For today's purpose, let's see if this is work. Yeah, I decided to keep the presentation not very science-heavy, not to keep it very boring. So I just wanted to show you a brief overview of what's the research we are working on, what's our group about, and just a tiny snapshots of my own personal research project in my PhD. And hopefully we would have some time to have some questions at the end too, and any suggestions. So who am I? I just kept this here. I'm Pooyan Moradi. I'm a fifth-year PhD student at the Department of Medical Neuroscience at Dalhousie University. I'm Persian originally, and I'm from Iran. I moved to Halifax in 2018, and I've been loving it. It's the best city I could wish for. It's the lifestyle. I don't know if it's the people, if it's the ocean. It's something that has kept me here going and meeting with lots of people. So it's been very nice here in Halifax. What I do, I'm actually a part of a very diverse research group. It's called Blood-Brain Barrier Research Group. It's a cross-Atlantic, very diverse research group that, as you can see, our collaborators are distributed all across the world, from US to Canada to Europe, Israel, Middle East. It's a group of neuroscientists, clinicians, mathematicians, and engineers even, that we have one big goal that we have, and the tying knot here is that using the barriers of the brain to understand different diseases, including a stroke, epilepsy, brain trauma, psychiatric disorders, etc. To just tell you about the research that's happening here at Dalhousie with our group, just a very quick overview of the topic. Traumatic brain injuries, you're very familiar with. It's, by definition, it's a structural damage to the brain that halts or interrupts the brain normal function. There are many clinical classifications, but the most general one divides the different types to mild, moderate, and severe. And as we all know, the more than 2/3 of the traumatic brain injuries are classified as mild, or as we know them, concussions. We in the lab, we divide the concussion itself to different types of injuries depending on how they happen. It can be a direct impact, very fast movement of the brain inside the skull, or a blast injury, which can happen during the combat forces. What I'm more interested in about mild brain injuries or concussions is about the prolonged symptoms. Because as we know, we can divide the injury to the first initial impact, which we are all familiar with when someone having a concussion, they can show symptoms of confusion, memory loss, amnesia, etc. But when it becomes problematic is that these symptoms, they can last. And these, when I say last, it can take from weeks to even years after the first injury. And this becomes worse when you have repeated number of injuries. And these prolonged symptoms, sometimes they're called as post-concussive syndrome. They have a very wide range of spectrum of symptoms that can affect the behavior, emotions such as anxiety, cognitive problems, all the things that we have discussed here. And even worse, and these symptoms can make changes in the brain that are permanent. They can change the brain's wiring that can lead to hyperexcitability. And by that, I mean seizures, epilepsy, loss of memory, etc. And this becomes a really big problem, especially in one type of injury, which are the repeated mild traumatic brain injuries, which are a common type of injury in hockey players, in football players, athletes that are involved in the high-impact sports. And as we know, athletes, they have a very underreported range of TBIs because they just want to get back to the game, and most of the cases, around 50% of them, they remain misdiagnosed or underreported. And these prolonged symptoms, they have, the statistics shows that even years, decades after retirement in these professional athletes, they can show their symptoms. One of those prolonged symptoms is actually the epilepsy post-TBI, and the data shows that these epileptic syndromes, they can manifest 6 to 7 years minimum after the injury. And the problem here is that there is no biomarker, and the biomarker is a technical term that tells that there is no predictors that we can separate or flag out those athletes that they are at risk of epilepsy. And why is it important? I think Ruth and Diane reported these statistics from, I got it from the Brain Injury Nova Scotia, that it's actually important because it's affecting a lot of people, millions in Canada, and here at home, Nova Scotia, 70,000, that's not a small number, it's a very big number, and more than 7,000 people are dealing with the long-term effects, these prolonged symptoms, and most of those people are under age of 40. So it's a big deal, it's important to know it, and it's important to understand it. But why is it challenging to study TBIs? If you look up the challenges in the TBI research, the list goes on. It's a very long list of challenges that us researchers face. I didn't want to put all the lists there, but I just wanted to pay one attention to the last of those challenges, is that there is a lack of biomarker, there are a lack of predictors that we understand. We have seen the statistics, but we still cannot tell people which people are at highest risk. And as you know, the human studies are challenged because there is not always a lot of participants, they opt out of the research. So we still need a lot of understanding of TBI, and there is an unmet need for understanding the mechanisms. Yeah, I'm doing good with time, I think. Dr. Friedman, my mentor, and his group has been working on these TBIs for more than 25 years, around 30 years. And they have approached the disease from many, many different angles, from mechanisms of brain disorders, using different methods to diagnose the disease, and also using tools such as animal studies and new treatments to approach and treat the symptoms. The part that I'm more involved in, particularly about my research, is about animal studies and new treatments. I'm just going to give you just few snapshots of my data here that I'm more involved in this cluster. So what we do in the lab, and what actually we published this work with my colleague, Dr. Ellen Parker, in 2021, that we actually induced a model, we developed a model that actually mimics the features of a repetitive mild traumatic brain injury in animals. But as it's important for us to take care of the animals as the humans, we perform a very critical care after the TBIs on these animals to make sure their health is in a very sufficient level and they are under constant observation of veterinarians. As you can see on the top panel, it shows this apparatus that causes the impact to the brain, but also it includes this swelling and this acceleration of the brain that can happen during the game too in human lives. Right after the impacts, we perform different types of tests to check for behavior, balance, memory, and other features of these animals to make sure to check if that TBI has an impact on those animals or not. This doesn't stop there. I actually added some new domains to the protocol too, because we know that it's not just about the immediate effect, but I also check for different domains of cognition and emotion of the animals. That includes anxiety, depression, spatial memory, working memory, and all of these have their own particular tests that aim on that specific domain. The part that I'm more involved and much more enjoy from it is actually, it's very novel and very time-consuming, is that we implement and have a 24-hour, 7 days a week continuous brain recording from these animals. And by continuous, I mean when we induce these impacts after the injury, I perform the surgery on their brains, and we implant some electrodes on their brains, and they are moved back to their original housing, taken care of, making sure they are healthy, and then we wirelessly transfer their brain activity into a brain. So we make sure that these animals are not strangled with the wires and they are just in their normal status. Sometimes there is debate that are these animals are actually happy, or are they normal, are they behaving or not. So we actually collect the videos. So we wirelessly watch these animals too. So I just brought some clips here from these animals to show you that these animals are actually happy. I think if Sam can play this video, you can see. So grooming, as you can see, he's scratching. Grooming is a very normal behavior in animals that shows that they are healthy and happy. We can tell based on their color of their skin and how they are groomed and clean. Sometimes we give them some toys. They like to hide their toys from us. They can play with their bedding. All the characteristics of a normal animal, that they are playful, they like to play with their toys, they have a nice sleep, awake cycle. So they're happy. So what about the TBI? What can TBI can cause to these animals? Here is just where it gets a little bit too much details, but I decided to just show you very, very few figures that I have that just gives you the gist of the impact of this model. You remember those behavioral tests that I performed right after TBI? And that's not just one. We induced these impacts multiple times, and each of those lines shows a healthy animal that did not get a TBI, and that black line shows the animal who received the TBI. And it's obvious that the animals with TBIs show a significant steady decline after impacts. But it's not as simple as is that. When we digged and looked closer to these animals that were concussed, we've realized that some animals were more sensitive. They were more, we call them more susceptible to TBIs, which was very, very intriguing for us, that why some animals are more susceptible and why some of them are resilient and they don't show any symptoms. And this is a repetitive case, and we have so many other students in the lab that are seeing the same classification. I'm not going to get into the details that why and how this can happen, but I'm going to show you that these sensitive animals, they are the one also showing these cognitive emotional problems, but the twitch was that the resilient animals, they were not immune to. Around 40% of those resilient animals, they also showed the cognitive and emotional symptoms. Going back to the other side of the research, the seizure detection, I use, here you see a snapshot of the brain activity of a normal segment, an epileptic segment, and this is done by softwares that are trained to detect the seizures across very, very long segments of brain recording. And it's really helpful because there is a very huge, large bunch of data set that I have to look at. And which is more interesting is that when we look at the videos, these epileptiform activities are showing some behavioral symptoms that are just, you can, Sam, if you can play the video, you can see these abnormal behaviors that are associated with those epileptiform activities. You see that animals are showing some weird movements that are not typically seen in a healthy animal. They have some stretching, weird type of grooming. Sometimes we see that these animals are frozen. They're having these freezing movements when they are doing their daily behavior task. they're freezed out. And also, we are seeing some twitches, small head nods. If you pay closer attention, you can see that these animals are twitching their head. Also, it's interrupting their day-to-day activity. They're eating, and all of a sudden, they are frozen, and they're kind of confused at what is going on. Here is an animal that is drinking water, and all of a sudden, he just freezes. And without any external cause, he's just twitching. And if you pay closer, there is some contractions in their, rhythmic contractions in their head and in their eyes. So unfortunately, it's associated with some abnormal behavior, but it's not a very full-on tonic-clonic seizure, but it's more involved with small twitches, focal seizures such as this. If you're interested in the statistics, we perform a lot of tests, we collect a lot of data, and we do a lot of statistical analysis. But to just show you how frequent they are and how they evolve over time, these seizures that you see on the first graph, they have an upward trend. And when we hit them at the very young age, you can see a very steady increase over time. Also, it becomes very, very frequent in TBI animals. But here comes the twist again. It was very kind of surprising for me, but challenging. And it's fun to know that both resilient and susceptible animals, they had an equal chance of epilepsy. There was no telltale or clear-cut point that the sensitive animals are going to develop epilepsy or not. So it doesn't stop there. It goes on, and I have more ideas of how we can tell epilepsy from the non-epileptic animals. It's an ongoing progress. I'm working on other biomarkers, such as the brain activity itself. My preliminary data shows that we can use it to predict epilepsy. That could be a very game-changer technology that we can use. It has been tested on Alzheimer's, other epileptic syndromes, but in TBI, we can use that to point out the chance of epilepsy. This morning, I was just looking at this icon that it doesn't show a grad student working, so I actually replace it with this tired student behind the computer, because it's going to be a lot of looking at the computer and looking at these brain recordings, and I have not much battery left, but I'm trying to push through. The last part of my research is about actually treating epilepsy and treating the long-term complications, which targets a system in the brain. I have to explain that it's the blood-brain barrier itself. And it's a barrier that separates the brain from the circulating blood. It's not okay that everything that we have in our blood that can go to the brain. It's not an optimal thing for our brain. But when there is an insult to the brain, such as brain injury, that barrier leaks and becomes dysfunction. And there are particles in the blood that are not supposed to be in the brain leak into the brain. And they activate some pathways that can eventually, months or years after, they make the brain epileptic. So this drug that I'm testing, which is very novel and for now is not patented yet, it would block these internal inflammatory pathways in the brain that would, the preliminary data shows that they are actually having some good effects. That stay tuned, this data, I'm going to publish it, and hopefully it would be a good paper. And to summarize, I hope I convince you that this TBI research is important. Finding biomarkers are important. Long-term syndromes are often disregarded. And this preclinical and clinical research helps us to identify these populations that are at risk. This last semester, I had the opportunity to go to Dublin to present this data in a conference, epilepsy conference, which was a fantastic opportunity. I received a lot of feedback, a lot of work I had to go from the experts actually in the epilepsy region. And I just wanted to say thank you to Brain Injury Nova Scotia, because they actually they provided travel assistance to me, and also because they are such a wonderful volunteer society to work with. It's an amazing experience for me as a researcher to be exposed to the population that are dealing with TBI. And it's a lot of fun. Just these collaborative work between science and the patients is a lot of fun for me. And I cannot forget that this work would have been done without the people behind the work. I'm not just the one who's working there. My supervisor, Dr. Friedman, or lab techs or engineers and all the other students in the lab, the Brain Repair Center especially. And yeah, if you have any questions, suggestions, or collaborative ideas, you have my email. I'm here also for the questions, and thank you so much. Yeah, sure. I think, do we have time? I think, yeah.
Well, question one, just two really quick. Was that Alain Friedman? Yeah, okay, because I worked with him in the recent past. But the other question, I don't know, I could be reading or studying in school, and my head would collapse on the desk, and often. And that's not a sign of epilepsy necessarily, because I can't hear too well. You know, the sign, and I couldn't catch some of the technical phrases that you were using, but, oh, sorry. So was that a sign of epilepsy or just general fatigue because of brain injury?
Thank you for the question. So I'm not a clinician. It needs an expert idea if whether or not you're experiencing episodic episode as epileptic episode. But based on what our discussion in the lab, anything can be considered as an epileptic event. So you might not even know that you're having an epileptic seizure while you're performing your task. So these zonings out, these even a slight interruption to your comprehension, it can show up in your EEG, or even if it cannot show up in your EEG. So it's a very complex disorder. And if you ask Dr. Alain Friedman, he would even consider that we don't know exactly are you having epilepsy or not. So that's why it needs much more digging into the symptoms. Yeah.
Hi, thank you. With the risk of increasing anxiety in the room, can you unpack that very polite word of impact? How are you acquiring the brain injury on these subjects? I've seen the diagram, which caused a lot of anxiety, and I would have preferred to have had a spoiler alert so I could have left the room. I find it very anxiety-producing that when somebody is deliberately inflicting an injury on an animal. So can you please unpack that in a way that makes sense, that's not polite? I would prefer the honest answer. Thank you.
In a laboratory environment, when we submit a protocol for inducing TBIs on animals, it has to go through an animal care committee. And what they check they check many classes of animal welfare. They would ask us to report critically, day to day, that if animals are showing any symptoms of pain, anxiety, weight loss, abnormal behavior, which are very, very well classified in the literature. So every day, the veterinarian comes in and checks right after the TBIs what are the symptoms in these animals. If an animal is stressed and anxious, it would look like a curled up animal. It would not move around. It would have a very ungroomed skin. And also, there are some pre-TBI options that we have to go through. We have to anesthetize these animals. These animals are having a minimal amount of pain because they are not aware of what is going to happen to them. They are not actively awake animals. They are anesthetized with a very deep anesthesia agent, and when they wake up, it's actually 20 minutes after the TBI. They wake up with a small sort of imbalance in their system. What we do make sure is we do a critical care, such as we give them serum, we give them extra food, we check their weight every 5 hours. So we make sure these animals are having a very minimal pain. But I understand your point. Our research is moving toward the animal-free environments because so far the animals are the closest we can get to the human brain. But with this data that we are collecting, we can train the computers to predict the outcomes without even needing of a living organism. I hope I answered your... And I apologize if the videos were triggering for you. I should have... No, exactly. Okay. Yeah. So it's a weight drop model. It's a weight drop model. So animals are laid down on a foil, and there is a very lightweight, around 200 or 300 grams of weight. It's falling down on animal's brain from a certain height. And we had made sure that impact doesn't kill animals, doesn't cause any bleeding. It is just a knock on the head, on their head, because it's been counted based on the animal's weight and age. So there is minimal surface injury in the animals. They just get a knock in the head, like we do get like in a football or in a hockey, without, it's not a severe, it's not a moderate TBI. It doesn't penetrate or cause any injury in them. Exactly. So what we do, we give them at least 24 hours to recover from each injury. And if they meet our veterinarian's criteria of health, we give them another impact. So it would mimic if you have a bad concussion, you wouldn't typically go to play the game again. So, but if you're in a stable status, you would go on playing the game, and that's what we do. Yeah.
So the first question is just a quick point of clarity. So when you talk about susceptible versus resilient animals, do you refer to different species of animal or different individuals? And I'll ask the second question and then give you the mic. The second part, you've been here in Canada long enough to know our love and affinity for hockey, and you've seen the news of professional hockey players suffering CTE later in life, and unfortunately, you know, some committing suicide, some having behavioral issues that put them, you know, in opposition of the law. I'm wondering if some of this behavior testing versus a control could be an earlier indicator of potential CTE issues later in life.
Thank you. Very good questions. For your first question, no, they are not different species. They are actually these animals are actually brothers and sisters. They are from the same mother and the same species, but they have different response to the same injury, which is interesting. And we have research, if you're wondering that why some animals are susceptible, we have research by other students, Sarah, in our lab, that shows that response to stress, the cortisol response, for example, it can predispose these animals to being susceptible. And regarding about your second question, I actually had a slide which I thought it's not that uplifting. It was about the exact same issue about the CTE in the athletes, that the behavioral and emotional burden of a TBI can lead to the depression, isolation, and eventually I had a slide about 4 or 5 football players who committed suicide eventually. I do actually, if I can go back, I have a slide for that. So here, what I was trying to make a point of that, as you see, the susceptible, the red bar, these animals they have been identified or flagged as a susceptible animal at the very first weeks of the injury. But there's a time lag between these behavioral tests and those flagging. So we actually can predict those susceptible animals that they are in higher chance of anxiety and emotional issues, which is actually a biomarker, but it's kind of a given. If you are a very susceptible animal to the injury, you're more likely to develop symptoms. But as I mentioned, if you're even a resilient animal, you still have 40–50% of chance of developing epilepsy compared to the control unhit animals. I hope I answered your question.